Hello, my name is Tucker Floatman. This is my third case study for SPCE 638, in which I'm going to be discussing the training protocol for a client of mine, as well as methods of studying um, procedural integrity and validity of treatment. So, just a refresher on Josh, who is the client I've been doing for these case studies. He is 7, lives in Cape Girardeau, Missouri. He was diagnosed with autism at age 3. He's been receiving ABA services with my clinic for 2 years now. Josh is non-vocal, but he uses a LAMP device, AAC program or AAC device using the LAMP program. Communicates very well with that. He is able to communicate his needs very effectively. Um, his behaviors of concern are screaming, aggression, and SIB in the form of biting his hand. I've mentioned in my last two case studies that his parents are seeking a diagnosis for OCD. In the time since my last case study, he's actually gotten the diagnosis. He does now have an OCD diagnosis. So, some of the concerns with Josh before training any new staff are that obviously he just received a new diagnosis like a week ago. So, that's going to obviously have an impact on the protocols we have for him going forward. Um, on top of that, he has started a new medication for the OCD. We all know, working in ABA, that any new medication, it's going to be the Wild West for a little bit. You don't really know what to expect for at least a few weeks until they level out. So that is a relevant factor to consider when training new staff. The behaviors that he exhibits have been pretty intense. His aggression is pretty intense, and I mean, he can really pack a punch. So that's something that we need to consider, especially with training new staff. So one of the concerns that we might have is that maybe with all these new changes he's experiencing, that might be a really good time to start training new staff rather than being a hindrance to someone else coming on board, because that new staff is coming in kind of on the ground floor with some of the new protocols we are implementing for Josh. So that might actually be a really good time to start training some new people with him. Um, so my organization uses a 3-session training outline. So every staff who is working with a new client has 3 sessions of training. For the first session, they're basically just shadowing. They're watching a seasoned RBT. Generally, the client's like lead RBT. Um, they just kind of observe the session, ask some questions, and then we really focus on providing opportunities for them to pair with the client. And that's really a priority for the first couple of sessions. For the second session, it's a little bit more hands-on. They're observing still, but then for the second half of the session, they're going to be running the trials. They're running the DTT programs. And then for the third session, they basically take the lead, and the seasoned RBT is still there, providing support, providing feedback in the moment. But for the most part, it is the new hires show. So the way that we assess the competence of the new hire is that we complete the RBT competency assessment with every staff for every client that they work with. And we do that after they have completed their third training session. So basically, their BCBA is going to monitor the use of their protocols that they've put in place. They're going to measure how thoroughly they're following the programs that every RBT should know, because it's the same competency exam that they used for their certification. And then on top of that, the supervisor is regularly providing the normal amounts of supervision that they are required to by the BACB. The way that we measure procedural integrity, specifically with Josh, but also with really every client in our organization, is that a BCBA or a practicum student like myself shadows a session once a month or once every 3 months for each RBT, for each client they work with, and fill out this checklist that basically just tracks their adherence to the organization's protocols, as well as the general RBT protocols that should be the same across the board. And that's things from preparing for their session, getting materials ready ahead of time, but it's also things like taking the appropriate time to pair with the client, taking the time to ensure that basic needs are met prior to beginning any trials, making sure that motivating operations are not going to be a hindrance, that kind of thing. And that is completed for every RBT, for every client they work with every 3 months. With Josh specifically, we have a kind of an addendum to the procedural integrity checklist that just focuses on addressing his problem behaviors, not providing reinforcement specifically to the SIB, since that's the main behavior that we are concerned with at the moment. So, responding to the behavioral support plan appropriately and enacting the protocols that were written by Josh's BCBA. Then, the way that we assess the validity of the treatment is we do that by convening with Josh's parents. Um, they are given a form that they complete every month, and that form just basically asks them to track his behaviors in the home setting. Because we obviously have a good idea of what they look like in clinic, but once he's out the door, it really depends on it relies on the parents for us to know what's going on. So they kind of analyze what his behaviors look like at home, and they also assess if he is using some of the skills that we teach him in the clinic in his home setting. When they have completed the form, we discuss this with them at the monthly monitoring meetings that we have. So that's normally the BCBA, the caregivers, and the lead RBT for that client, which in Josh's case is myself. So I'm part of those meetings. We discuss like what the challenges that the new challenges that are arising look like, whether he is generalizing the skills that we've implemented, and then overall we just see like, is what we're doing working, and does it matter? Are we really seeing meaningful change? The good news is we had our last one of those meetings on Friday of this week, actually, and Josh is just really thriving across all settings. We're hoping that with the new medication and the new diagnosis, we're really able to get down to the core of what's causing some of these behaviors, and we're really hoping to see some positive change moving forward. So thank you for taking the time and watching this. And yeah, that's a summary of Josh. Thank you.